morning.
Morning. All right, thanks for taking the time to come meet today before we go see our patients. So we had a meeting last week about the Healthy People 2020 initiative to reduce the amount of pressure ulcer-related hospitalizations among our older adult community. So I just wanted to take the time to kind of review what we talked about. At the end of the meeting last week, they did say, let's think about things that we can do to make this initiative happen. We are all home healthcare nurses, so I think we have a very important role in making this Healthy People 2020 initiative become a reality. So let's decide about let's have an open discussion, guys, about what we all came up with and what we think is important related to pressure ulcers. So what's one of the first things that comes to your guys' mind when we think about this 2020 initiative?
Definitely prevention, because we have to prevent people from getting the pressure ulcers. We can prevent them from getting the pressure ulcers, then they won't be hospitalized because of that.
Yeah, definitely, that makes sense. So if our patient doesn't get a pressure ulcer to begin with, then they don't have that chance, just like Ajoke said. That's a great thought. However, and unfortunately, we don't really spend too much time with our patients. I did find an article that kind of put those into numbers for us, and it did state that if a community nurse visits a patient for a half hour once a week, then they only see that patient for 0.2% of that week. And I thought, when I read that, I was like, oh wow, puts into perspective. We don't really spend that much time with our patients, so how can we prevent these pressure ulcers if we are only spending such a short amount of time? Any ideas?
I think it's really important that we have to educate. Like you said, we're only there for a very short amount of time, so we have to educate the home health aides that are there with them, but even those home health care aides, we have to find out how much they understand the importance. But when they're not there, even the family members that are taking care of the patients maybe through the night.
Yeah.
So I think really education is important.
Definitely, Kelly. Good.
Once you know what to do, the prevention is, not that difficult. If you're able to inspect the skin and just look and see what's coming up.
For sure. And we also need to keep in mind that we need a good relationship with our patients and the caregivers. If we can't have a discussion with our patient and caregivers, how are we going to educate them? So we all always need to try and maintain that open line of communication and that good relationship.
It may also be a good idea to assess how much knowledge, as Kelly had just said, how much knowledge the patient has about pressure ulcers, as well as the family and as well as the home health care aides, and how they feel about it. If the client is really frightened of the possibility, we need to make them comfortable by educating them.
I think we can if it's difficult for us to educate them, we can use handouts and stuff, posters, some handbills, show them what to do and stuff. And
definitely, we should never assume that our patients, and if there is any aides in the home and caregivers, we should never assume that they know automatically how to prevent the pressure ulcer, or if the patient already has one, how to treat it. So, just like you guys said, assessment of knowledge is definitely very important.
Like you said, the key is to prevent these from progressing to the point where these patients need to go into the hospital. So everyone needs to kind of be hands-on to treat these as they're coming up.
Definitely. And one important part of education is nutrition. So, we all know that nutrition is very important for not only preventing but also healing pressure ulcers. And protein is one of the most important nutritional aspects that our patients need. And a good amount I found in a research article should be about 1 to 2 grams per kilogram of outside sources of protein the patient should be having a day. I did develop a handout for our patients and families, and this handout should give the patient and the caregiver a better idea of what the patient's daily intake should be, and also talks about fluid requirements. And I hope that this handout can be more of a simple design for them, easy to read, easy to understand. I also put some information about why nutrition is important. I have inadequate nutritional and dietary intake are some of the major risk factors for developing a pressure ulcer. Those who experience weight loss due to insufficient nutrition are at a higher risk of developing the pressure ulcer. Risks includes those who are underweight as well as overweight, and proper nutrition aids in healing with those with existing pressure ulcers. So, and then on the back, we want to look, everyone look around.
Thank you for doing that.
I kind of like the way like it puts like the foods and stuff, like saying that like 2 to 3 servings of protein a day, like you have like 3 ounces of meat, 1 egg, like kind of like puts it there so it doesn't look like grams and grams. Nobody measures in grams, so like many people don't really understand that. So.
I tried to make the handout easy for our patients and our families to understand.
That's pretty.
Great job.
Attractive. Well, that's important. So.
All right, awesome. So that's kind of just my thoughts on educating with nutrition. Ajoke, do you want to share what you came up with next?
Yeah, I'm read a lovely article about positioning, and it was talking about how positioning is very important to prevent pressure ulcers, and like it was talking about like the number of hours for positioning, and it was they said like even though like many hospitals they have like you have to reposition every 2 hours, like when they did the research they really couldn't be like the results came in inconclusive actually, because like the research, like they were like, okay, 2 hours, 4 hours, 6 hours, and we were like trying to get like which one is better? Is it 2 hours? Is it 3 hours? Is it 4 or something? But they really couldn't like pinpoint which one was better, because like sometimes the 6 hours for some patients the 6 hours doesn't matter. For some patients the 2 hours they will still develop a pressure ulcer. But like I think generally like most hospitals, most facilities, they have it down to be 2 hours. So like we should educate our caregivers like to make sure that they turn the patient and we position them at least every 2 hours. And like on the so like this ways to like put a patient. So like for the 30-degree tilt, like they are saying that we should make sure that we position our patients on the 30 degrees. So it's better for us to use 30 degrees than the traditional 90 degrees. So the 90 degrees, the patients, there's more pressure on the bony surfaces of the shoulder and then of the hip, and because of that, it causes more problem than it solves. So when we are turning the patient, it's better for us to use the 30-degree tilt, not to turn them fully, just slightly like 30 degrees. And like if we also have to like look at the patient, because if the patient is like obese, like our obese patient, we might have to like increase the angle to like up to 45 degrees, but like usually the 30-degree works for most patients. Then also like if we are talking about the support, like the authors were like saying we should try to use the firm feel rather than the soft feel. And what they mean is that when we are repositioning the patient, we should try to use supports that will be firm, supports that will be soft enough to be comfortable for the patients to lie on, but will be firm enough that the patients will not change position after a few hours. If you look at this is a soft feel. This is a patient that was positioned in a soft feel. This is when the patient is newly positioned, and this is what the patient looks like after 2 hours. If you look at it, you see that the patient has already changed position, and the repositioning is almost ineffective because the patient has already gone back on the back. But if you look at this is a firm feel, and the patient after 2 hours, the patient still looks like that, and the patient is still comfortable in that position. So that is what we should try. So instead of using pillows they tend to like go flat after a couple minutes. We should try to use like wedges that are like designed for those purposes. It is better to use wedges and stuff like that. Then also when we are repositioning patients, we should try to reposition them for comfort And for them to be comfortable, research has shown that the shoulder, the pelvis, and the spine have to be in alignment in a straight line, no matter the angle that we are putting the patient in. So, like, if you look at this patient is lying on the back, and we see like the shoulder, the pelvis, and the spine, they are all in a straight line. And then this patient is 30 degree. He's lying 30 degree sideline position, and the patient, even though it's sideline, the shoulder, the pelvis, and the spine, they are still on a straight line, and that helps to make the patient comfortable. And also, we have to the legs also have to be slightly flexed, abducted, and rotating outwards. That also helps patients to be comfortable, no matter the position they are lying in. We should try as much as possible to make sure that they are comfortable.
All right, that was all really good information, Adjoke. Thank you for looking that all up and presenting that to us. We should all be keeping positioning in the back of our minds when we're with our patients, and it's definitely an important part of education, as well as keeping our patients out of the hospital for pressure ulcers. Kelly, would you like to share about what you came up with?
Actually, mine goes right along with Adjoke's because
Perfect.
what I did research on was the different equipment that's out there in order to help prevent pressure ulcers from occurring, and also to help them to heal if they already are occurring. So I also made a billboard. If we see what's out there and we know what's out there, then we can better educate our patients and their families on what's out there. So the first thing I looked up were different pillows and wedges that are out there, and I found this microbead system, which is really nice depending on the type of patient, because you can see they make all different shapes and sizes of pillows, and it helps to position the patient. They might not be the best firm-wise, so we would have to take into consideration the type of patient we have, how immobile they are. But what they tout is the fact that they're much easier to adjust because they have the microbeads in them, and also you create less shearing and friction when you're adjusting or pulling them out from patients. So that's a system that's out there that I thought was nice. And another system that I liked, I really liked this one, which it talks about that 30-degree tilt that you were talking about at Adjoke. So these wedges put the patient at that 30-degree tilt. And the one thing I really liked about this system is you can see it's all the same shape pillow. So you just have to buy the one pillow. A lot of the systems have all different shapes, so then you're trying to figure out what goes under what body part. But this, you just have one shape pillow, you buy a couple of them, and you can see all the different positions you can put the patient in. You can even just use it to prop the legs to keep the heels off. So I really liked this system. Another thing I looked up were different pressure relieving devices that are out there, and this keeps the bony prominences off. They make them for the heels, what I have here, it's a boot. They make them for elbows, different things like that. And I have a picture here of a cutout because honestly, I didn't really understand how they worked either. So we can explain to our parents, to our patients and their families, how it keeps, you can see it's propping up the ankle, but the heel is completely free from any pressure. So patients can wear these, again, to prevent ulcers from starting. The heels are a big spot where they start, or if they have one, keep it elevated so that they have time to heal so that they don't progress, like we said, to the point of hospitalization. And then another one that I looked up, which these are really nice, but much more technologically advanced. They're these mattresses, and they're called alternating pressure air mattresses, or APAMs. And I have here a diagram of how they work. They have these little all different cells in them, and they inflate and deflate at different times in order to take pressure off. And this helps to relieve pressure and to help to redistribute the pressure in case they have any ulcers or to prevent them from occurring. And I know this can be really pricey, so I did do research to see how effective they were, because I don't feel like it's something we should talk our patients into with spending all this money if they really don't work. So I found this great article in the British Journal of Nursing. I can print a copy up for everybody to show to their families. and it was specifically about these types of mattresses in the home setting. And what they found was, I have some statistics here, that 53% of pressure ulcers improved with these, and 20% remained the same. They didn't get any worse. The only percentage that deteriorated were 7%, and they found that all those people were at the very end of life and only had 7 days left within the last 7 days of their life. So again, everyone, 50% improved and 20% didn't have any more deterioration. So we can see that these are really effective in preventing pressure ulcers or maintaining them at the rate they're at so they don't progress to the hospitalization. And with all of these things, I'm a consumer too, and I know if someone was telling me about these things, I would want to know how much they cost to see if it's worth it. And so I did look up insurances. So Medicaid and Medicare will cover for these devices. But the important thing is on our end that we have to document properly. So what I'm going to do is I'm going to make a handout. I'm going to do a little more research and figure out exactly what they want that we can take with us on our home visits and make sure that we get all these documentation pieces in there on these pressure ulcers. Because as long as the insurance companies see that this is something that's necessary, they will cover it. And I think this is something that will help family members they'll be more apt to agree if they realize like our insurance company is going to cover this. So again, all of these things I think are really important in helping to work towards that Healthy People 2020 goal and not have these pressure ulcers progress to the point of these people going into hospitals.
That's great, because you make it totally easy. It's like, check this, this, and this. No excuse to not do it. So, as a wound care nurse, in addition to home health care, it's very important to make sure that we treat ulcers that should develop appropriately to prevent hospitalization. And I know that is simplistic, but it's the case of it. People will often assume that once it starts, there's not much you can do, but that's just not the case. I'm going to talk about a couple of different things about assessing the wound, about pain management, about dressings, just to make sure we're all on the same page. When you do assess the wound, you want to do a very comprehensive initial assessment, including complete health, medical, and social history, and a focused physical exam, which includes the things that may affect healing. The vascular assessment of the extremities, if you have ulcers there, because of course you need good blood flow to heal them. The risk for developing additional ulcers, how well the person functions in terms of shifting their weight or providing self-care, and their general knowledge and belief and expectations of having these ulcers heal. They need to know they can do a lot towards that. You want to look at the ulcer initially, and then reassess it at least weekly. And if within 2 weeks you don't see some signs of healing, you should take a close look at the aspects of it, at the type of dressing, etc. Because within about 2 weeks, you should be seeing some signs of recovery. And in terms of recovery, it's important to make sure that both the patient and his family members, the significant others who are taking care of him, know what that healing process should be. Because we know, but they may not have a clue. They may think it's going along fine when it's actually deteriorating. So we need to make sure that we do teach them about that normal healing process, how to identify when it's deteriorating, and at what point they need to contact us or the primary care physician.
Yeah, that's definitely something we haven't talked about, so thank you for bringing that up. Yeah,
indeed. And it goes almost without saying that documentation is huge in wound care, not only for insurance, but also for our monitoring of the wound. If you want to make sure you know the size, how deep it is, what type of exudate is coming out, is it tunneling or sinus tracts, because all of that gives you clues. It tells you exactly where that wound is in healing or in not healing. So just like in everything else, documentation is really key. If you do see deterioration, don't fool around with it. Don't wait. You want to address it immediately. And that has to be impressed upon the patient also. It's not that, looks a little weepy, she's coming tomorrow. For that wound, it might be that, no, you want to give her a call today. Or the doctor, give them a call today, because it can make all the difference in whether or not that wound heals. In terms of pain, as you all know, the pressure ulcers are very painful. And patients experience it very specifically. They know what's pressure ulcer pain versus, joint pain, or if they've broken a bone. The bone pain may or may not be real obvious, but if they have an ulcer on their ankle because of the bony prominence, they'll know that. And you need to encourage them to express it. Just as with patients who are reluctant to express pain in general, those patients who are stoic, they do so at their own peril, probably too strong a word, but we need to know what the pain is like. And it's not just when they're at rest, but also during procedures, the pain is especially bad. Notably, if you're debriding or doing something that's disrupting the tissue. So you want to use the drugs you have that are prescribed to not only medicate beforehand. During, if needed, there are topical opioids and other anesthetics that can be used, and afterwards. So you've got the tools at hand. If you don't, talk to the PCP so you can get the tools at hand. And avoid pain as much as possible because, A, the stress of it actually slows down healing, and B, the patient's going to be a lot more optimistic if they have as little pain as they can.
That's true. I know you will help with the healing.
Absolutely. Something else I wanted to talk about was cleaning the wound. Obviously, it's going to be clean each time you change the dressing. And if there's infection involved, whether it's the person or the wound or the environment, you do want to make sure to use aseptic technique. It doesn't have to be sterile, but using aseptic technique, pretty much whenever you deal with one, will help. You want to make sure if you have an ulcer that has debris, that you use a cleaning solution that has a surfactant or an antimicrobial. And when you are working with an ulcer that has sinus tracts or undermining or tunneling, you do want to clean them thoroughly enough with enough pressure to flush out the debris, but you have to be really careful about injuring the tissue even further. So it's a fine line, and the more you work with it, the better you get with it. And in terms of debriding, because we just mentioned that, you want to make sure you're taking a close look at the tissue, and if it's devitalized, if it's non-viable or necrotic, you need to take care of that. And it often will happen if the patient in general is deteriorating or if there's a biofilm. Those are two areas in particular when you want to take a look at that. As I mentioned before, part of that whole process is making sure that wherever the ulcer is, particularly in lower extremities, that there is sufficient blood supply, that there's no vascular issues. And then finally, really, unfortunately, because it can be painful, you have to just keep going back and back until it's clean. If you leave any of the organic material, any of the devitalized tissue, that can reinfect. So you need to make sure it's clean and covered with granulation tissue, and then you've done right. And then the last thing I wanted to talk about was the type of dressings. Regardless of what you use, you need to select a dressing based on its ability to keep the wound bed moist. You also need to take a look at the types and amounts of wound exudates. What condition is the tissue out, and how big and nasty is that ulcer. Some types that we use fairly often are hydrogel, film, alginate, and gauze. And I'm just going to briefly touch on the advantages of each of those. Hydrogel is best used on fairly minor, shallow, minimally exuding ulcers that have started to granulate. I'll get it. If you actually have an area that has not progressed very far, that also doesn't have depth or contours, you can use those, the sheets, the hydrogel sheets, you can use those. In terms of film, most of them are impregnated such that you can use them for autolytic debridement. And that's a pretty nice system. It used to be that you had the jar and the gauze and worked with them together, but now we have the sheets impregnated. You can also use them as secondary dressings when you're using an alginate as the primary dressing, or other fillers that are likely to stay in the ulcer bed for an extended period of time. Alginate you can use for worse wounds. If they're moderately or heavily exuding, alginate's good. And as that dressing, as the wound heals, when you start seeing that the wound is dry, when you take off that dressing, you can then extend the interval between wound dressings with the alginate. And finally, let's take a look at gauze, which is certainly very economical. But you need to avoid using it for open pressure ulcers right after they're cleaned and debrided, because they're labor intensive. They cause pain if you've let them get dry before you remove them. They dry out the tissue, and all those things can be contrary to healing. And you look at risk benefit, and the fact that it's inexpensive gauze, may not play out sometimes. Also, as we all know, avoid moist to wet. Avoid moist to dry, wet to dry. Back from nursing school, you just don't use them anymore. And of course, in keeping them moist, what you're really doing is you're just stopping evaporation. And you need to think of it like that. You can also use gauze to loosely fill ulcers that have, gaping holes in them and dead space. You'd use saline moistened gauze, and that helps you avoid putting pressure on the wound bed. If you do, though, make sure you use a single strip or roll of gauze. You do not want to be putting in multiple dressings because any retained gauze in the ulcer, should you miss a piece when you're taking it out, that can serve as a source of infection. Yeah. So just wanted to hit the highlights of some of it, but we do have to remember and teach our patients that if we treat those ulcers properly when they've started, that can go a long way to keeping them out of the hospital. But definitely, if one starts, it can be stopped.
Well, great. All very good information. Kelly, did you have something else to add?
I just really like that point that you said, because when Kelly brought up when we started our meeting, we're only in the families' homes a very short amount of time, and I don't think families realize how quickly these things can progress.
Absolutely.
So, we know as nurses, when you see something that just looks like a bruise, all the skin's undermined underneath that. So you really have to, like you said, educate the families on how quickly these things can deteriorate and when to get in touch with someone.
Yeah.
Yeah, we've all brought up really great information, and everything we've talked about today is definitely a part of accomplishing that 2020 initiative of keeping our patients out of the hospital for pressure ulcer related reasons. That's our main goal here. So when we go off to see our patients today, everyone should keep what we just talked about in the back of their minds. And also, Kelly, with that checklist, great idea. If you could have that for us maybe tomorrow, so we can, when we go see our patients tomorrow, we'll document what equipment they had and maybe what they need as well. But overall, very good. All right, everyone. Thank you for getting up a little bit earlier and coming in today to discuss this stuff. And I hope we have a good day with our patients. Let's prevent pressure ulcers.